At hospitals and testing sites across the nation, a reason for optimism after a season of despair. New confirmed COVID cases across the country are down 42% in the last 2 weeks. Hospitalizations after a grim holiday season have dropped 26%. Even the daily death toll, which remains far too high, over 3,000 a day, has decreased nearly 7%.
Numbers have stabilized. We're holding our breath a little bit and hoping it stays that way. But every day we have just fewer number of patients with COVID than we did the day previously.
Due to the decline of cases, death, and hospitalization, we are beginning to see some ease of restrictions. For instance, the California Regional Stay-at-Home Order was lifted towards the end of January. Many vaccination centers have been opened so that we all can get vaccinated. And whilst this is going on, we have to keep in mind that the virus is still in our midst.
New variants, the potentially dangerous evolution of the virus, remain a serious threat.
We should continue to practice appropriate public health.
The best practices for prevention against COVID-19 are these measures: social distancing, staying home, especially when ill, not touching your face, and washing your hands. As researchers learn more about COVID-19 every day, guidelines may expand to adapt to the new information, so we should also be adaptable as we stay informed. One of these measures is a new CDC recommendation of wearing face coverings in public. So how do face masks help us? There are different types, but the most common ones you're probably hearing about are N95 respirators, surgical masks, and cloth masks. Medical-grade N95 respirators have a tight seal against the face and are designed to filter out 95% of particles, even the ones that are really small, up to 0.3 microns. Coronavirus, which is even smaller, only 50 to 200 nanometers, can travel in respiratory droplets of various sizes. So we rely on N95 respirators to filter out pretty much all large droplets and most small ones that may contain the virus. Having these respirators available for healthcare providers is critical to ensure they can treat their patients without sacrificing their own health and safety, and so they must be reserved for healthcare workers. Surgical masks are loose-fitting, so are mostly intended as a physical barrier, not a filtration device. They protect the wearer against large respiratory droplets, but not smaller particles, so are not considered reliable respiratory protection by the CDC. But they do protect others from the mask wearer's own respiratory droplets released from coughing, sneezing, and exhaling. Surgical masks should also be reserved for healthcare workers. The CDC now recommends cloth face coverings for the general public, masks made from a simple t-shirt, for example, for when you do need to go outside for essentials like to the grocery store or the pharmacy. Some states in the US have already started mandating this as well. Even so, the best practice is to practice social distancing and stay at home, but for essential outings, you should cover your mouth and nose with a cloth barrier. Cloth masks can act as a physical barrier and protect others from the respiratory droplets that you emit. You may not feel like others need protection from you, especially if you're not feeling sick. But the CDC estimates that 25% of people infected with the novel coronavirus don't show symptoms and feel fine, but they can still transmit the virus to other people around them. So it's a better safe than sorry practice. The only risk? You may start to believe it's protecting you more than it actually is and be fooled into a false sense of security. You may feel safer wearing a mask, but remember, it's meant to protect others around you, not yourself. The best way to keep yourself safe is with social distancing and washing your hands often and well. And once you get home, be sure to remove your mask without touching the contaminated outside part of the mask and wash it before your next use.
Take care of yourself and of each other. God bless you.